Thank you, everyone. It has been a difficult week in the life of all Canadians, but particularly so for people of Nova Scotia. And so for any of you who may be on this webinar with us right now, please know that we're with you, standing in solidarity, and that we're thinking of you and particularly the families and loved ones who've experienced such tragic loss right now. So we're with you and standing with you during these difficult times. We're now going to get started with our webinar, and it's my pleasure to get things started and to kick off our time together. Before we do so, I have a few housekeeping items to share. First of all, I should introduce myself. I'm Sara Austin, founder and CEO of Children First Canada, and I will be hosting today's webinar. We do have some housekeeping items to walk through. First of all, I want to say a special thank you to Boost Child and Youth Advocacy Centre for hosting this webinar and for this ongoing series to provide support to the National Network of Child Advocacy Centres across this country. We do have a few housekeeping items to go through. First, for participants who are listening in French, you can click on the floor at the bottom left of your screen and select French to ensure that you're receiving interpretation and translation. To see and follow along with a PowerPoint presentation in English, you can click on presentation at the top left of your screen. And to follow along with the presentation in French, you can download the French version of the presentation by clicking on documents on the right-hand side. Feel free to download the presentation in both English and French by clicking on documents on the right-hand side. There will be a Q&A during the last 15 minutes or so of the presentation, so I encourage you to submit your questions. You can go to the toolbar on the right-hand side and click on messaging and then click on participants. You can type in your question and submit your questions at any time during this webinar, and then I'll come back to those at the end of the presentation, and looking forward to being able to hear your questions and comments and respond and have a bit of interaction with you. And lastly, if you're watching this webinar in a group, in your workplace or in your home, please enter the number of participants in the group that are clicking on this message, by clicking on messaging and then participants, and letting us know how many of you are with us. That will just give us a good sense of who's with us today and how many we've reached across the country. So on that note, I'm happy to get started. For those of you who don't know me, I'm Sara Austin, founder and CEO of Children First Canada, and I'm really thrilled to be with all of you here today. This is a tough time for all Canadians, but particularly so for our children, and I'm really glad that we can come together as a community of people who care passionately about our children, a community of experts who are all giving the very best you can with your time and your talent to support kids and their families. And I'm very grateful to Karen and Pearl and the team at Boost for providing this opportunity. When they first reached out to invite me to present to you and to be a part of this webinar series, it was in I guess what we would call the best of times in Canada, and to really talk about the state of childhood in Canada and the work that we're doing at Children First to really raise the profile of kids in our country and to really advocate for the health and well-being of our children and the protection of their rights, and some of the ongoing work that we're doing to support kids across our country. And then, of course, the COVID-19 pandemic hit, and we are now in the midst of some very challenging times, particularly for children and youth, in ensuring their protection. And I know that all of you are on the front lines working to help kids who were already struggling through a challenging time, but also the very grave concerns that many of you have for the protection of kids under the challenges we're facing with social isolation, the closures of schools, and a whole host of other factors that are putting kids at risk. And I've been speaking with many of you in recent weeks and recent days, hearing from what you're seeing on the front lines, but also trying to find creative solutions. How do we come together to really put these issues on the radar and mobilize swift action, particularly on the part of our government, but also recognizing that every Canadian has a role to play in keeping our kids safe. And so really with this presentation today, I'm hoping to to take stock of what's happening for kids in our country and what needs to happen, and really, how do we move the needle for Canada's kids? And so we'll do that first of all, but just by taking stock of the state of childhood in Canada. What were things like in the best of times prior to this crisis? And then, really looking at the impact of COVID-19 on children, and particularly their vulnerability to abuse during this time. But also looking at, not just what are the problems, but what are the solutions, and how can we individually and collectively advocate for kids in your city, in your province, and across this country. So that's really what we're hoping to cover today, but I'm eager to hear your thoughts and get your response, to hear your comments and questions. So please do reach out throughout this presentation, feed in your questions and comments, and I'll be sure to come back to those shortly. There is a lovely quote that many of you may have heard before from Nelson Mandela, who said, "There can be no keener revelation of a society's soul than the way in which it treats its children." I think we tend to think of ourselves as Canadians about being world leaders in so many areas, about being a country that cares deeply for our children, and we think of ourselves as being world leaders when it comes to democracy, protection of human rights, the state of our economy. But when it comes to the health and well-being of our children and protection of their rights, the facts would prove otherwise, that in fact we have not been doing the best that we can for children. Whether it's in times of peace and prosperity, but particularly so in times of crisis like we're currently facing, we know that the kids are not all right, and that there's much more that we can and should be doing to really ensure the protection of kids' rights and ensure that they can achieve their full potential. And so, what I want to talk about now is really the state of childhood in Canada, and what it's like for kids, and what does the facts say about what's true for the state of kids in our country. There's this powerful quote that said, in a good and decent society, we take care of the children, because in doing so, we not only express our humanity, but we also ensure our future. And we hold in tension, the desire to do our best for our children, but also knowing beyond just the moral and intrinsic value of caring for our kids, that it also makes good economic sense, and that it's in the best interest of all Canadians to ensure that kids have that healthy start in life, and that we do our very best in particular to prevent early childhood adversity and mitigate and intervene as quickly as possible if children do experience traumatic events. And so what we've been trying to do at Children First Canada over the course of the past 5 years is really to be a strong voice for all of Canada's kids, to try and move the needle. And one of the real challenges that we're up against is that most Canadians think of us being a world-leading country for children, when in fact that's simply not true. We are currently ranked 25th out of 41 OECD countries for the well-being of children. And so we have a long way to go between where we currently are and where we believe we should be, and closing that gap. And so, for those of you who don't know about Children First Canada, I launched this organization in 2015 with this bold and ambitious vision of making Canada the best place for kids to grow up. We are an organization that brings together many of Canada's leading children's charities like Kids Help Phone, the Boys and Girls Clubs, Big Brothers Big Sisters, and more recently the Child Advocacy Centres through the involvement of Boost and Karen's leadership, but also we involve children's hospitals across the country, research centres, major corporations that invest in the lives of children, and kids themselves, really trying to rally those who care about children to work directly with children in identifying what are the problems, what are the solutions, and then really mobilizing the social and political will to take action. And so when I talk about Canada not being a world-leading country and lagging behind in 25th place, obviously one of the first questions that comes up is, so who's doing better than us? And so to put this into context, of course, we lag behind some of the usual suspects, namely the Scandinavian countries. But we also lag behind countries that perhaps might be surprising to you, whether it's Japan, the UK, Austria, Spain, Estonia, Portugal, the Czech Republic. I think it's surprising to most Canadians to find out where we actually rank when it comes to the health and well-being of our children, and to look at the landscape and think, what is happening in these other countries? When we think about all the things that we have going for us as a country around our healthcare system, our robust democracy and strong human rights mechanisms, why is it that we're lagging behind for children, and what's causing that to be true? And so that's part of our work, is really to try and dig below this data and understand how have we been falling behind. I think something that's important to note here is that this isn't just a new phenomenon. We've actually been going backwards for more than a decade. If you go back to 2007, Canada was actually ranked in 12th place amongst the OECD countries. And we have steadily made significant movement in the wrong direction. So we've been heading in the wrong direction for more than a decade now. Meanwhile, countries like the UK have been steadily making improvements. And so that's also part of what we're looking at. Why is Canada falling behind? And why are countries like the UK making progress? And what are some of the factors behind that? And so I'll be coming back to some of those key lessons learned shortly. One of the pieces at Children First Canada that we've been looking at is trying to have a strong research and evidence basis to this. So if we know that Canada's lagging behind OECD countries, what's driving that? So what are some of the key lagging indicators? And in 2018, we launched our first report called Raising Canada, looking at the state of Canada's kids. What do we know to be true in the lives of kids across our country nationally, but also looking at what are some provincial and territorial areas of that's where kids are either falling behind or leading, and what can we do, particularly at a federal level, to really lift the bar for all kids in our country. And so one of the things that we learned through this report, we did it in partnership with the O'Brien Institute for Public Health at the University of Calgary. We looked at all of the 8 million kids in Canada. One of the most staggering findings was that fully 1/3 of kids in Canada do not enjoy a safe and healthy childhood, 1 in 3. And that's because of a whole host of factors. We know, for instance, Canada has one of the highest infant mortality rates amongst OECD countries, and that particularly for kids in the north and Nunavut, that those rates are 3 times higher than the national average. We also learned that the leading causes of death for kids in our country are preventable accidents and injuries, followed by suicide. I don't know about you, but I find that deeply disturbing to know that our kids are dying from largely preventable causes, because we simply don't have the federal and provincial laws in place to keep our kids safe, around simple things like booster seats and car seat protection to keep our kids safe, let alone things like helmets and other very basic evidence-based solutions to keep kids healthy and well. But also, of course, more significant things around the need for mental health supports for children and for their families. There are a whole host of other deeply disturbing concerns that we saw around the sharp rise in demands for mental health needs for kids, and in the way that's presenting itself, particularly in emergency rooms across our country. Huge concerns around food insecurity, and even more so, particularly in a time like this, in a time of crisis right now. But also knowing that, a stat that most of you are probably very familiar with, which is that 1 in 3 adult Canadians has reported some type of child abuse before the age of 16, 1 in 3. And so when you think about the implications of all these different factors, of all these lagging indicators, it's really quite overwhelming, but also very significant to think about the scope of not only the challenge, but also the opportunity, that if we actually could move the needle on some of these key indicators, that we really could make significant progress for all kids in Canada. One of the challenges we are up against, not only in confronting the problem with evidence-based solutions, is that Canadians just don't know that this is a problem. So many of you may have been surprised to hear where we rank amongst OECD countries, but that's certainly true for the average Canadian. We've done recent polling on this just as recently as last November, in which it became clear that only 3% of Canadians know where we actually rank amongst OECD countries. And they're deeply surprised and deeply disturbed to find out the truth. And I mean, it's disturbing in some sense to know that Canadians are so out of touch about the challenges that our kids face. And yet I'm heartened to know that when Canadians do know the truth and the reality, that they're quickly mobilized and want to take action in terms of their own individual volunteerism and philanthropy and things that we can all do in our individual lives to support kids. but also in really using their voices to lobby political leaders, provincially, federally, to take action, because I think Canadians all care deeply about our kids and want them to get the best that they can to offer, the best that we have to offer. We are also really in knowing that Canadians don't have this firm grasp of the challenge. We've been trying to raise awareness, and so part of what we do at Children First Canada is really to try and raise public awareness, particularly through the use of media. So we do regular media campaigns at certain points in the year around release of reports like Raising Canada, but we also take opportunities to, in moments particularly like this current crisis, to really put these issues out in the forefront and to harness the attention of national and regional media to talk about what's happening in the lives of children, to really capture the attention of Canadians, hopefully to mobilize them to take action, and also through that public through the public relations and the media effort, increasingly building pressure on our government that they need to act. The more we can keep these issues in the headlines, the more pressure there is for our political leaders to take action. Part of our strategy is also to help children themselves to be at the heart of the solution. You know, it's certainly good that we are good and caring adults and doing our very best to serve and support kids. But if we take a rights-based approach, which is children have a right to participate in decisions that affect their lives. Children of all ages and stages, with all different levels of emotional and cognitive development, have a right to participate. And that is our job as adults, as duty bearers towards children, to find ways to support the participation of children, whether it's in family decision making or how we run our programs and services to benefit them, or at the policy level and bringing kids together at the table with policymakers to help shape the policies that affect them. And so one part of our work has been involved a youth ambassador program of training and equipping young children and youth across our country to be their own best advocates, training them with knowledge of their rights, but also providing them with a platform with mentoring and other support so that they can be spokespeople with government, with media, in front of business leaders, and be at the heart of our own organization and driving the decisions that we make. And one of those kids is Roman Wolfley. He's a 12-year-old boy in Calgary. And, you know, I think he's such a compelling young leader. And anytime I hear him speak, people chant Roman for president or for prime minister, because he is, you know, he's such a compelling young leader who has a firm grasp of the challenge, but also incredibly brilliant ideas about the solutions that are possible. But one of his wonderful quotes that I love is that he talks about, people like to say that children are our future, but we are also the present. We are Canadian citizens. If we could vote, perhaps the issues we face would be a greater focus. Listen to our voices, take action and support children. We are citizens of this country, present and future, disempowered, but as important as any adult. 18 is just a number. You know, it's a powerful quote, and I think, you know, any opportunity we can give to children and youth through the work that we have at Children First, but also in the work that you folks are doing at child advocacy centers, we need kids to come to the table with and be supported, to be able to be heard and be involved in these decisions. Roman was actively involved in many of our meetings across this country, really trying to help raise awareness, but also in holding government leaders accountable. I've seen him go toe-to-toe with the Prime Minister's office, with our Minister of Finance. And you know, it's really powerful to see that he and many of his peers can really be compelling in advocating for the protection of their rights. So as I said earlier, you know, most Canadians don't know that there's a problem, but you know, the good news is when they hear where we currently rank, that they are strongly motivated to take action. And our recent poll last November showed that, you know, an overwhelming majority, 91% of Canadians believe that Canada should put a high priority on improving its rating for children's well-being, so moving up that OECD ranking. And 4 out of 10 actually believe that it should be a very high priority. So clearly Canadians, when armed with knowledge and provided with accurate information, are mobilized to take action, and particularly where they have an expectation that our government does better for our children. So part of how we're trying to tackle these issues at Children First Canada is really trying to make what matters to kids matter to all Canadians. And so how we do that, this is You'll see here a bit of an overlay of our current strategic plan, which looks at really 4 main pillars. The first is providing children and youth with platforms to be heard so that they have an opportunity to learn about their rights, to be involved in decisions, and to be at the heart of really driving this national strategy. Second of all, we look at research and really taking reports like Raising Canada, and our earlier report, The Kids Are Not All Right, and using that as a tool to drive evidence-based decisions. We release that Raising Canada report typically every September, but we also do other reports like polling throughout the year, and we're taking the research that we've been doing and are now looking at how do we do a policy mapping. So these are the problems that exist. How do we actually hook those into the right policy leaders and make sure, understand who's on first and making sure that they're being held accountable to driving action. We are, of course, very much talking about raising awareness, and a lot of our work involves PR campaigns and harnessing social media. This past year, as we went into and throughout a federal election, we created lots of resources to harness the attention of Canadians and really mobilize strong policy decisions to support children by our federal leaders. We have an ongoing newsletter that you can sign up for on our website, but you're really trying to raise awareness and mobilize Canadians to take action. And that, the mobilizing action piece is really being focused around a few key pieces. The first is the need for a federal commissioner for children and youth. This is, if you go back to those original list of countries and who's really leading the charge for children around the world, the vast majority of them have a federal commissioner for children, have somebody who's evidence-based and who's independent and who really has the mandate in the federal government to lead the charge for kids. We have long advocated for a children's budget, so actually having greater transparency on the part of the federal government around what they spend on our children, where is that money going, and is it having the intended impact? We are increasingly now recognizing the need for a national strategy to actually move the needle on all these issues, but also recognizing that we have to operate within the context of a nation-to-nation relationship, and that we need a specific strategy for all of Canada's kids, but we also need to recognize the unique rights and needs of First Nations, Métis and Inuit children, and to work with the national Indigenous organizations in leading that. And lastly, we are, in terms of mobilizing action, we're looking at potentially a federal court challenge to lower the voting age. Coming back to that earlier point that Roman made around if kids could vote, perhaps federal leaders would actually pay more attention to their concerns. So we're in the process now of consulting children and youth about this very issue and looking at pursuing a court challenge on lowering the voting age. So I've given you a bit of an overlay of what were things like even in the best of times for kids in our country. And now let's dive into looking at what's happening in the lives of kids within this current crisis. Now, from the very outset, as COVID began to hit Canadians across this country, we recognized at Children First Canada that children would be highly vulnerable in this pandemic, not necessarily to getting sick, but to all of the unintended consequences of public policy making. And so in the very early days, I reached out to the Prime Minister's office and to several key ministers federally and offered our support. I signaled, first of all, that they need to be looking at the impact of this crisis on kids, but also to be working with us and many others on the front lines to hear what is happening in the lives of children and to make sure that we're making the best decisions possible and making sure that the frontline charities and organizations like the Child Advocacy Centers have the resources you need to do your work. And so we've been lobbying from the very early days and consulting our Council of Champions, including Karen Kennedy from Boost and many others across this country around what's happening, what are you seeing in the lives of children, and being able to bring that information quickly to the attention of policymakers in the Prime Minister's office and with several key ministers. You can see on our website, we've got some of those recommendations summarized in a document, but we've continued to keep that updated and providing regular updates to the Prime Minister's office and to all members of Cabinet. We have been working to provide resources directly to children and youth, as well as to parents and others around how to keep their kids safe and support them through this crisis. And so we have a number of resources on our website. Increasingly, we've been trying to provide resources directly to frontline professionals. Particularly, we've done webinars for the Canadian Association of Social Workers. Recently, we've just this week produced a new resource on the role of teachers in keeping kids safe in this pandemic, and particularly how to recognize the signs of abuse. I think I just want to pause on that one for a moment, because we know that teachers account for such a significant part of the safety net for children, that schools are a safe place for children typically, and teachers would be one of the first people to detect signs of abuse and be the first ones to report it, or for children to disclose abuse to. And so that's been a very real concern for us with social distancing and kids not being in school. And so we were really pleased to work with Senator Stanley Kutcher and Dr. Wendy Carr at the University of British Columbia to produce a new resource for teachers specifically on this subject. We just released it on Wednesday. You can find it on our website, but a whole host of resources for teachers on how to keep communication with kids open during this pandemic, probing questions that they can ask that could help identify if kids are at risk, but also really just keeping those communication lines open so that kids know that they can go to their teachers if they're really struggling right now. But also knowing, just a good helpful reminder to teachers around their duty to report and how to report and what to do during this crisis. So hope you'll take advantage of that resource, share it with teachers far and wide. We're hoping to do a webinar with teachers coming up soon, but just realizing that teachers are such an important part of the safety net in keeping kids safe right now. We've done a whole host of other resources that you can find on our website, but if any of you have ideas around other things that we can do to keep kids on the radar during this crisis, please don't hesitate to send me an email and contact me, because we're eager to get your thoughts and ideas, share them on this webinar here today, but we're looking at whatever we can do to keep these issues on the radar. And we have been looking at things like the need for public service announcements on TV and radio directed towards children, but also towards adults, but also open to any other ideas that you might have. And of course, we have been lobbying for the need for funding for the charitable sector. We know that frontline charities have been hit hard by the impact to their revenue, and that there's a need for stabilization fund to keep charities running and going, not only during this crisis, but for months and years to come. So we've been hearing that there should be news coming on the stabilization fund for the charitable sector very soon, and we'll certainly be sharing that with the Child Advocacy Centre, and that of course all of you will be eligible to apply for that. In terms of what have been some of the specific concerns that we've had around the vulnerability of children during this crisis, particularly when it comes to abuse, of course there's the high stress environments that kids are in. We know that child abuse was a significant concern even before this crisis. So let alone when kids are now home in social isolation and parents are dealing with economic stressors, just simply being everyone being cooped up at home. A whole host of factors that are playing in there. Those high stress home environments are certainly putting kids at risk right now. As I said earlier, we know kids no longer have the safe haven at school, and teachers are less likely to detect signs of abuse and report it. And so that's where we really see a need to try and help fill that gap. We know as well kids are spending a lot more time online with more access to devices, with internet access. And a lot of that time right now is being unsupervised because parents are working or distracted with other things. And so even very young kids, but also teenagers, having all this online access without supervision, of course, is putting kids at risk to online exploitation, but also exposure to pornography, which we know also plays a role in child abuse. And so this has also been a very grave concern of ours. And of course, the social isolation that kids are facing, and particularly for kids who have a history of trauma, who were already struggling, the kids that you folks are caring for day in and day out, and that those kids are really limited in how they're getting care right now and supported. And the importance of that continuity of care is so vital. So that's been another concern we've been trying to flag. I mean, the good news is we have been having some impact with our advocacy efforts. It's not enough, but at least we are making some progress. One of the things we had recommended to the federal government was the need for the Prime Minister and for government to be speaking directly to children and to be investing funds in the organizations that serve and support kids. We've brought forward a whole host of funding needs, and we are continuing to lobby for those fundings. It was certainly encouraging to see some early funding being released to Kids Help Phone, because we know that's such a vital safety net for kids, and that they've had a huge spike in demand for their text and phone call service in the recent weeks. So that funding was certainly a very important first step, but we know a whole lot more is needed, particularly for child advocacy centres, for the Children's Aid Foundation of Canada and the National Network of Children's Aid Societies, for children's hospitals and for other frontline charities. We know you folks have needs, and we are certainly lobbying for you, and we'll continue to try to do our best to leverage resources to be made available to support the work that you're doing. We've also been lobbying for the government to speak directly to children, and we've been encouraged that he's taken that to heart and has made it a weekly tradition, if you will, of speaking to kids in his Sunday press conference. One in particular has now been turned into an animated video, an animated Lego video, which of course is quite compelling, but it just speaks to the way that we have been able to be effective in highlighting that children are not just victims in this crisis, but they themselves have something to say, and that they need to be given the opportunity to know that our government is paying attention to them, but also have the opportunity to respond. And so we had also lobbied for the Prime Minister to have a press conference with kids, and so he took that recommendation. And as all of you would likely have heard, he did a media interview with Dr. Teresa Tam, with a child journalist at CBC. More than 4,000 kids submitted their questions, and the Prime Minister and Dr. Tam responded by video. And again, it just speaks to the need for children to be heard and for their questions and ideas to be shared with our political leaders. It's not a silver bullet, but it does signal that our government is listening to children and is listening to their concerns and responding. We've also had significant headway in making this issue public and really trying to make a tough issue something that the public is aware of and concerned about, and being involved in the solutions. And so we've had lots of media coverage, which has been encouraging. Of course, we'd rather not have to do this. We'd rather this not be the case, but we think it's important to talk about child abuse within the context of this crisis, and to inform policymakers around what they can do, but also to inform just your average Canadian around what they can do. We all have a role in keeping kids safe, and so that's part of our strategy with these media efforts, is trying to help Canadians know how they can be a trusted adult in the lives of children, what to do if they suspect abuse, what to do as a parent if you're struggling, and how to get help. And so the media campaign is ongoing, and where we're continuing to spread the word. But it's really important that each of you in your own child advocacy centres and with your professional organisations do what you can locally to engage with media. I know Dr. Michelle Ward has reached out to a number of the child advocacy centres and really encouraged you to do that. And again, just really, I want to reiterate how important it is for us to keep these issues on the radar throughout this crisis and beyond. And I don't know about you, but I'm encouraged by the amount of attention that we're getting to such a really difficult issue, and the fact that we are having, as a country, a conversation about something that's really hard to talk about. Federally, there has been leadership on this, internationally, there's been strong leadership on this as well. The UN Global Initiative on Ending Violence, multiple leaders came together to issue a statement about how kids are vulnerable to abuse during this crisis and what needs to be done. And so I encourage you, if you haven't yet seen it, to download that global statement and think about, what does it mean for us in our own context. So lastly, I want to turn to the opportunities for advocacy. We've talked about the problems, we've talked about the real gaps that exist, but what can we do individually as just individual people, parents or community members, as citizens, but also what can we do as the national network of child advocacy centres to really help our kids through this difficult time. They say it takes a village to raise a child, but I believe it takes a nation to raise a nation. If we want to move from being 25th to becoming a world-leading country for kids, it's going to take every single one of us as citizens, but also all of our agencies working together. Of course, parents are the primary caregivers for children. Parents and guardians are the primary safety net for kids, but we know that parents can't do this alone. We need strong policies, municipally, provincially, federally. We need the investment of resources for parents to be able to do that really tough job of raising healthy, well children. And so whether it's the best of times or the worst of times, we really need to come together as Canadians to help raise our nation. I love this quote by Fred Rogers, who talks about, we live in a world in which we need to share responsibility. It's easy to say it's not my child, not my community, not my world, not my problem. But then there are those we see, those who see the need and respond, and I consider those people my heroes. I know you people are those heroes, that you are working every day to do your very best for the kids in your own families, let alone the kids that you're serving through your organization. So I want to say thank you. Thank you for what you're doing to be a virtual village for kids, and just encourage you to keep going. I know it's tough and we're all feeling the strain right now, but just keep going with everything that you're doing at an individual level, and encourage others to do the same. I think I wanted to share a few ideas that I had around what we can do around in how we spread awareness about these issues and how we can encourage people to be taking action. It's a very simple idea, but this each one teach one. And like, most kids in Canada don't know that they have rights, have never heard of the UN Convention on the Rights of the Child, don't know that they have rights to everything, to right to protection from violence, let alone the right to participate in decisions that affect their lives. So really encourage whatever you can do in your own families, let alone through the scope of your professional practice, to teach children their rights and to involve them meaningfully as rights holders, and as I often say, children are their own best advocates when they're equipped with knowledge of their rights. Of course, we need to be spreading the news. So engaging your media, whether it's through press releases or on your website, social media, everything you can do right now to spread awareness about how this crisis is impacting kids, and mobilizing members of your community and beyond to take action is really important. Encourage you to stay informed about what's happening beyond just your regular sphere of influence. So, you can certainly sign up for our newsletter and follow us on social media, and we'll keep you informed about what's happening on the advocacy front federally, but also opportunities to stay engaged with others across this country. Of course, we're encouraging Canadians that if they're concerned about a child who's in need of protection, that they need to report that to the local child protection agency or the police, and particularly to call 911 or the local police if a child is in imminent danger. So the more we can continue to repeat those messages about reporting suspected abuse, the more that message will get through. But also trying to dispel myths about what happens when a report happens. Often parents are concerned about reaching out for help because they're, the very real concern that a child is going to be removed from their home. And the more we can send out positive messages about the role of child protection agencies like the child advocacy centers and social workers in helping be that safety net to keep kids safe at home wherever possible, I think will help to really encourage parents to reach out for help when they need it. And lastly, of course, we're trying to really engage federal leaders and to put the pressure on them to act and mobilize them. And so, again, using your social media, personal and professional, to get the word out, to call on our Prime Minister and the key ministers to take action. But also don't forget you have a local MP, the MP for your home riding, but also the MP in which your organization lives. And so I encourage you to tap into your local MPs as well, because they also can be a powerful advocate for you. So those are some individual actions you can take. And of course, there's lots we can do collectively, whether it's through your own child advocacy center or nationally through this network, really trying to do what we can around public service announcements. If there's an opportunity to do a joint statement like the leader statement that I shared with you at the global level, we're happy to consider something like that with you folks. Of course, there's a need for research through data collection around what's happening throughout this crisis. We know that everyone's primary focus right now is on serving and supporting kids, but if we can be collecting meaningful data now that can inform our decisions that are happening in real time, or that can be used to leverage both public awareness but also influencing policymakers, the better off we'll be able to get timely decisions. So, really encourage you to think about how the data you're collecting through your government agencies can be used as a tool for advocacy now, but also in the months and years to come. But also, thinking about what can we do to continue to strengthen the practices of the professional agencies involved in doing this important work. I spoke earlier about some of the things we've been doing through webinars and producing resources like the teacher toolkit, but encourage you as well to think about things you can do through your organizations at the CACs, but also through this national network of CACs to really strengthen the capacity of professional services to support kids throughout this crisis and beyond. Those are some immediate opportunities that we had. One, as I spoke earlier, one of the things we've been mindful of is that kids themselves need to be at the table in some of these decisions. And so we right now have launched a youth advisory council. The applications are open for another 2 more weeks. And so if you know of young people through your organization or even in your families and communities who could be great advocates for themselves and for their peers, please encourage them to apply, because the more we can equip kids to speak up and be advocating for themselves, the better off we'll be. It's one thing for you or me to sit at in front of policymakers or be lobbying with media or what have you, but it's another thing for a child to be doing that through their own lived experience and be powerful advocates. And so certainly encourage young people to apply to this Youth Advisory Council. We have some good resources on our website. I encourage you to go to childrenfirstcanada.org to download them. We have posters of the UN Convention on the Rights of the Child in child-friendly language. We have some t-shirts and of course our reports on the state of Canada's kids. So I encourage you to go to our website, childrenfirstcanada.org. But we also have a website, nationalchildday.org. As many of your organizations celebrate National Child Day every year on November 20th. We've now launched this national website to support, common messaging and common tools that we can all use in hosting local events, but also raising awareness and teaching kids their rights. So go to nationalchildday.org. We'll be uploading some new information about this year's event and how you can be involved in the campaign in the days and weeks ahead. And lastly, as we wrap up this formal presentation and before I prepare to turn to questions and comments, I just want to leave you with this thought and this quote from Paulo Sergio Pinheiro. Paulo served as the UN Special Representative on Violence Against Children at the UN. He led the UN's first global study on violence against children that I was one of his advisors and worked closely in that study. And one of the key messages that came out of that report, and that I continue to hold at the forefront of my mind all the time, is that no violence against children is acceptable, and all violence against children is preventable. Every aspect of it. We know that to be true in the work that all of you are doing at the child advocacy centers, and in the work that we're doing at Children First Canada. And so we need to be advocates for children and doing whatever we can to prevent violence, particularly at this time of crisis when we know that there are so many unintended consequences of keeping kids at home for this extended period of time. And so I just encourage you, as you continue with your day-to-day work, to do whatever you can to continue to be a bold advocate for kids, and to remind society that we have, our kids deserve the best we have to offer, whether it's in times of peace and prosperity, but particularly in times of crisis. So on that note, I will pause, and I've left our contact information here on the screen, and you can certainly have that in the slides that you'll be downloading as well. But I want to now open it up to questions and comments, and I'm going to adjust here my screen so that I can actually see the comments and questions and move over to that. Just give me 1 second as I switch my screens here. Sergio, I may need some technical help here and make sure that I haven't mixed up the slides here. Can you still see the slides on the screen? Pearl or Sergio, I'm not sure if either of you can hear me, but if either of you can just confirm that the slides are still up and that we're good to go, or I'll just stop sharing the slides. I'm not sure what's happening here. I'm just looking for some comments from, just give me 1 second here, folks. I'm going to stop sharing the screen, but hopefully you folks can still see me, and I'll be able to respond to your questions and comments. So I'm just going over to the questions and comments section now to see if there are any questions that have come here.
Hi, Sarah. Can you hear me?
I can hear you, yes.
Great. I'm going to refresh quick.
Yeah, so I saw you stop sharing your screen, which is great. People can download the slides in the Documents tab, and they have that last slide there.
Okay.
Messaging tab, there's a few questions under operators and participants. So if you scroll up operators, there's a question just a few comments up. For those listening, if you can please post your questions in one of the chat channels under participants to keep them all in the same place, that will be great. Thanks.
All right, I'm just scrolling through the questions now. One here, what is the possibility of making mental health available through OHIP coverage for families and children? That's a good question. I'm afraid I don't have an immediate answer to you, for you, but I'm happy to take that away and get back to you. I know we certainly have been, through our advocacy efforts, really working to raise the significant needs of the child and youth mental health right now during this crisis. When I talked earlier about the need for mental health supports for the funding needs that we've been highlighting through this crisis, the children's hospitals in particular and Children's Healthcare Canada, which is an alliance of many child and youth health serving organizations, we've been really working to identify what are the mental health needs of kids, not only in this crisis, but what is anticipated in terms of a mental health tsunami following this crisis. And so we have brought forward a very significant funding ask to the federal government in the realm of 150 to $200 million of funding that's actually needed for mental health supports for children and youth through the children's hospitals and child and hospitals serving children, but also health serving organizations. And so we have been lobbying with Health Canada and the Public Health Agency of Canada for funding specifically on the mental health needs of children. I mean, of course, it's great that Kids Help Phone has got the funding they need to be able to take calls and answer texts from children, and that's mental health, provide some mental health supports to kids right now, but we know that kids need a continuity of care. And so that's really where we see the role of children's hospitals and hospitals serving children as being really vital to that response. And so we are actively lobbying on this issue for federal funding. Provincially, we would hope that there would be funding available as well. We haven't been as deeply immersed at the provincial level, but federally, I can assure you that we are actively working to get funding released to provide mental health supports from coast to coast to coast. So stay tuned for that. I don't see any other questions right now. Oh, here's one. What is the best way to explain the pandemic to children without creating anxiety for them? Yeah, this is a great question. I mean, it's certainly something that I think many of us as professionals are dealing with, let alone as many of us as parents or aunts and uncles or family members, and how to help our kids make sense of this really challenging crisis. There have been lots of solutions put out there on social media and a whole host of websites. And I just encourage you folks, as you're messaging this to kids in your own families, let alone through your professional practice, to lean on the advice of professionals. There's lots of talk about this, but one trusted source that I've often leaned on throughout this crisis is Senator Stanley Kutcher, Senator from Nova Scotia, who has a vast wealth of expertise in child and adolescent mental health. And he's, one of the things he's talked about is the need for, for using good language about this and not confusing words like, professional diagnoses like anxiety and depression with what are just average, or not average, but more typical fears that children would have, and helping our kids to understand in age-appropriate ways and developmentally appropriate ways what they're dealing with, and also not overwhelming our kids with information. One of the things I continue to hear about is that kids are feeling the stress because they're just hearing about this all the time. Parents have got their TVs or radios playing, and I'm mindful of this even in my own home, that our kids are just hearing a lot of noise about this crisis, and quite frankly, often their kids have had enough of it. We as adults are feeling overwhelmed with it. So really to be mindful of trying to not overexpose our kids to media and all the talk about this pandemic. And I think, if most importantly, trying to help our kids to have a sense of, just asking simple open-ended questions. How are they doing and how are they feeling? But also trying to provide reassurance that this is really tough, to acknowledge their tough feelings, and also helping them with co-regulation. And we know how important co-regulation is, and that in order for our kids to be calm and well, we as parents and caregivers need to be calm and well, and to be modeling that co-regulation with them is really important during this tough time. But also, aside from what's happening with this overall pandemic, that, you know, the tragedies of what's happened in Nova Scotia, and helping to talk with our kids about what's happened recently, and the great fear lots of kids are, particularly in Nova Scotia, feel right now about being in their homes, let alone going outside of their homes. And so just encourage you to turn to trusted sources like Senator Stanley Kutcher and others, great organizations like Kids Help Phone and Jack.org, another youth mental health initiative, to look for some good suggestions for how to talk about this with your kids, and provide them with a sense of reassurance, and to keep those communication lines open with our kids. Looking here for some other questions. A comment from Laurie in Nunavut, that many kids are safer outside than being in their home, and how can we assist these children during the pandemic? You know, a great question, and I think it's something that I'm hearing increasingly, particularly whether it's from kids up in the north, but also kids even in urban areas, and that home, particularly for kids who home is not a safe place. How do we provide safe places for kids outside of their home? I've been hearing that there will be some guidance coming from the World Health Organization and from UNICEF and the WHO around how to provide kids with a safe place to be outside of their home. I'm afraid there's no easy answer for you today, but I'm happy to share some resources that will be coming out from the UN shortly on this topic, because I think the more we can provide kids with an opportunity to be safe outside their home and get access to trusted adults, you know, the better off they will be. And certainly hearing lots of discussion about even some schools looking to open, or, you know, how to provide, whether it's kids who are kids of essential workers or kids who were in homes where there's lots of risk factors, how to provide those kids with a safe place to be outside of their homes. A comment here from Kelsey that there have also been several ebooks and comics developed to help explain COVID to kiddos. Absolutely, there's some great resources out there. We've certainly been sharing some of those on Children First Canada's social media and on our website. But if you folks have others that you have seen that you think would be great to share, please email them to us or tag us on social media, and we'd be happy to retweet those and share, because we know that parents are very hungry right now for resources to help support their kids through this time. Alexandra has shared out the link. I mentioned jack.org. It's a youth-led mental health initiative, and their website is jack.org. And if you go to jack.org/COVID, they've got some youth-specific resources on mental health during the pandemic. So that's another good resource. A question here about how to speak to about supporting children when we eventually go back to normal. Yeah, this is a big topic. I'm certainly hearing a lot of talk about this, whether it's in some of the media interviews I'm doing or with professional organizations across this country. What is the new normal even going to look like? You know, as some jurisdictions like BC and Saskatchewan are looking at opening up or, you know, taking away some of the restrictions and opening up schools, or having kids return to some sense of normalcy. What does that even look like? And we've certainly been calling for the need for testing of children for COVID before there's a widespread opening of schools, because we really have no idea right now how many kids are carrying the virus, and, you know, we certainly don't want to see a triggering of a new community spread as a result of the opening of schools. But we've also been urging schools and frontline organizations to think about, you know, really what we anticipate to be a huge surge in child abuse reports, as well as, you know, just a significant mental health tsunami for children and youth because of the stress and, in some cases, trauma that they're experiencing right now. And so, and even very practical things like many kids are going without nutritious food right now because of the restrictions of not having access to school nutrition programs, let alone the issues of domestic violence, family violence, and violence against children. And so we've been calling on the federal and provincial governments to think about how to equip schools in particular to meet some of those needs, but also really calling for funding for, particularly for the child advocacy centers, so that you have the resources to be able to meet a surge in demand. We know that after school closures like summer holidays and Christmas holidays, that you always have a spike afterwards, but we're expecting after this crisis there will be a spike in demand around child abuse reports as well, perhaps even bigger than typical school closures. And so you folks need to be resourced to be able to meet those demands, not only in the short term, but for the long-term supports that these kiddos need. And so we'll keep advocating for you folks to have the resources to be able to do that. Another good resource that's been shared here is about a good place to go to around some resources here is protectchildren.ca. It's another great organization sharing good resources on protecting children from violence, and encourage you to go check that out. A question or comment here from Tracy. She said, I've been hearing about parents who are not following the education that is expected to be done online, advocating that parents push the academic work getting done as a way to keep kids grounded. Is this recommended? This is a tough one, because I know all of us want to see our kids supported around their learning during school closures, but parents are also feeling the huge stressors of all of a sudden not only having 24/7 being the 24/7 child care at home, but also juggling that on top of work and other things. And I think some of the best advice I've seen about supporting kids' education during this time is helping kids to have a sense of predictability to their day, creating some routine and a schedule with your children, working with them to create that schedule. Some schools are providing it, but I think if in the absence of that, working with your family to create your own modified schedule, what's reasonable and what can be expected of you. We're certainly encouraging parents to support their learning needs of their kids, but some of some of the most important learning that our kids are getting right now is how to be resilient. And the more we as parents can model resiliency and help our kids co-regulate, those are like essential life lessons that our kids will be needing. But also recognizing that parents are really struggling with the online learning that's happening. There's been such a patchwork of approaches across school jurisdictions across the country. Some school boards have got great resources online and offline for kids, and addressing issues around connectivity and how to keep kids engaged and ensure equity of access. But some school districts are really struggling and haven't really stepped up in the way that our kids and families need right now. So, I think continue to advocate for this, both for the role of teachers and schools and supporting our kids, but also, reasonable expectations for what parents can and should be doing in light of all the other pressures that parents are facing. We're coming to the end of our time, and we have about 3 minutes left, and I'll just take this one last comment from Francesca. We're working tirelessly to keep the communication open to our children and youth clients through Facebook and Hangouts, and we offer fun activities to get them engaged and distracted from being overwhelmed from abuse from online schoolwork. So yeah, that's great. A great suggestion from Francesca. I think providing kids with vehicles, with platforms to be engaged with each other and with trusted adults outside of their home is just trying to create some sense of normalcy and connection. Our kids are just really struggling. We're all struggling with social isolation, and the more we can help support kids with connection with trusted adults outside of their home and with their peers is really critical right now. So great work, Francesca. I just encourage all of you to think about other ways that you can help maintain that sense of normalcy for kids who were going through tough times even before this crisis hit, but are even struggling more so right now. So I think that brings us to the end of our time. I just want to thank all of you for being with us for this discussion today, for this webinar. Again, just want to say a huge thank you to all of you who are working on the front line to support and care for kiddos who have immense needs, and not only supporting kids who were struggling before this crisis and helping them get through it, but also anticipating and responding to the very significant demands that kids are facing as a result of increased violence in their homes right now. And just encourage you to stay connected to our organization and through this network to tap into a circle of peers across this country. We're in this together. I know we've all heard that time and time again, but to be able to lean on each other with creative ideas, but also if we're struggling to reach out and ask for help. So don't hesitate to reach out to me and to Children First Canada if you have ideas or resources to share that we could help support your efforts. We'd be more than happy to hear from you. And I, again, want to thank you for joining us today, and thank you for the very important work you do every day. Thank you to Boost Child and Youth Advocacy Centre, to Karen and Pearl and your amazing team for all that you do to support the national network. And thank you all for joining us here today. Thank you so much. Stay well, and we'll look forward to staying in touch. Bye-bye, everybody.